Hello everyone, here we are going to cover grading and staging of cancer. You usually get a short question either on grading or on staging or both of them, but you never get long question on that. So short or very short question on them. So let's start. It's a small topic, grading and staging of cancer. So you can see we are starting the topic, that is grading and staging of cancer. So first I will let you know the introduction, why grading and staging is important, what is grading, what is staging, and one of the important system of staging, that is TNM staging, we will see in detail. Okay, so grading and staging are two different things. Many students have confusion or misconception. They think that grading and staging is one and the same thing. We divide the cancer into 4 grades, 1, 2, 3, 4. We divide the cancer into 4 stages, 1, 2, 3, 4, but they are different things. So let me start with the introduction. What do you mean by grading and what do you mean by staging? Both of them are necessary to predict the prognosis of the cancer, to predict the tumor behavior, the prognosis of the tumor, the prognosis of the cancer, and to guide the therapy, grading as well as staging. So grade 1 and stage 1 tumors have favorable prognosis, good prognosis, and grade 4 and stage 4 cancer have poor prognosis. So they are required to predict the prognosis, and stage wise and grade wise the treatment can be different. So they are required for two purposes. Number 1, to predict the prognosis of the tumor or cancer, and number 2, to guide the therapy, because different stages and different grades can have different treatment therapies options available for them. And grade 1 and stage 1 always have better prognosis, good prognosis, as compared to grade 4 or stage 4. So what do you mean by grading and what do you mean by staging now? Grading is the gross and microscopic appearance of a cancer based on the degree of differentiation of the tumor. I will let you know what is degree of differentiation. And staging is the extent of spread of the tumor within one patient. So let me explain you in two diagrams. For example, the patient is having a cancer in the stomach. For example, this is the gastric carcinoma in a patient. There is a patient having gastric carcinoma here. Let me draw the tumor here. So this is the tumor I'm drawing here, and this is the tumor I'm drawing here. So for example, this is the normal cells of the stomach. These are the normal, the blue one are the normal cells and the red one is the cancer cell. So I have to see the degree of differentiation. The tumor cell, how much they resemble the normal cell. That is the resemblance, the extent of the resemblance is known as differentiation. So how much the tumor is looking like the normal or how it is different from the normal, that will decide the grade. So for looking to it, we require microscope. So grading is always done by pathologist. It is always done by pathologist. It is based on the microscopic appearance. Microscopic appearance of the cancer cell. The red cell, how much they resemble the blue cell. I mean the tumor cell, the red cell is the tumor cell. How much they resemble the normal cell. The percentage of the resemblance or the percentage of difference. For example, 50% are resembling, 50% are different, for example. So this is the grading. I will tell you the details. This is grading. And what is staging? Now here you can see the tumor. This tumor can show the metastasis in multiple organs. The multiple secondaries are formed. So the extent to which it is spread it to the lymph nodes and spread it to other organs. The extent to which the spread of the tumor is there. We are looking the spread, how much the tumor is spreaded in the entire body, and that decides the stage. Staging is regarding the spread. You can learn S for S. Staging is regarding the spread of the tumor, and grading is regarding the microscopic resemblance of the tumor cell with the normal cell. I hope you are getting the 2 points. What is grading? What is staging? So grading is done by the pathologist because it requires the microscopic appearance. Microscopic appearance is done only by pathologist. Staging is the spread of the tumor. How much the tumor is spread in the entire body. We predict it with various tests like the PET CT scan. So it is done by the clinician. It is done by the clinician. And this one is done by the pathologist. I hope you are getting what is grading and what is staging. What is grading and what is staging? Grading is microscopic appearance, microscopic resemblance of the tumor cell with the adjacent cell. That is grading. And what is staging? Staging is the spread of the tumor in entire body. How much? The extent of the spread of the tumor. Grading is done by pathologist. Staging is done by the clinician. I hope you got the basics. So same thing is written in front of you. That is the introduction. With this introduction, I told you the grading is done on pathological basis and the staging is done on clinical ground. So this one is done by pathologists. This one is done by the clinicians. Now we will see the details of both of them one by one. Let's start with grading. I told you it is the gross and microscopic degree of differentiation of the tumor cell from the adjacent cell. Now you can see in this diagram the pink cells. Can you see the pink color cells? These are the normal cells of that tissue. For example, it is breast. So the pink cells are the normal breast cell. For example, it is stomach. So pink cells are the normal stomach cells. For example, it is brain. So pink cells are normal brain cell. So whatever tissue it is, in which organ the tumor it is that, the pink cell are the normal cell of that organ. I hope you are getting it. What